Hi guys, welcome to FastCoder 21 Medical Coding YouTube channel. FastCoder 21 YouTube channel has all the interview Q&A related to inpatient, outpatient, SCC, anesthesia, denial management, and all other coding related topics. If you are visiting for the first time, please click on subscribe button to receive future updates. Please watch until the end to gain in-depth knowledge about ICD-10 CM 2023 guidelines. Please like, comment, share and learn. Guys, today we are going to learn ICD-10 CM 2023 guidelines, chapter 19, which is injury, poisoning and certain other consequences of external causes. Code ranges from S00 to T88. Our first guideline is application of seventh characters in chapter 19. Basically, most of the categories in chapter 19 is having seventh character value for three character values, which are initial, subsequent, and sequela. If you take fractures, we have more than three seventh character values, which we are going to learn further. While the patient may be seen by a new or different provider over the course of treatment for an injury, assignment of the seventh character is based on the whether patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. So basically, whenever we have the documentation to code injury, we need to check the documentation whether the patient is undergoing active treatment or condition has resolved. In this scenario, whether the provider is seeing the patient for the first time or second time, it does not matter in coding injury seventh character value. For complication codes, active treatment refers to treatment for the condition described by the code, even though it may be related to an earlier precipitating problem. So we have an example here. For example, we have T84.50 into A. So infection and inflammatory reaction due to unspecified internal joint processes initial encounter is used when active treatment is provided for the infection, even though the condition relates to the prosthetic device, implant or graft that was placed at a previous encounter. Basically here, patient has infection and inflammatory reaction due to internal joint processes. So patient is visiting for the first time for this condition like infection and inflammatory reaction. So here we will consider it as a initial encounter. Even though patient has infection due to the joint processes, we need to consider as uh, initial encounter as patient is going to undergo treatment for infection and inflammatory reaction. So we can code here as initial encounter. For the infection, usually seventh character A we will use for initial encounter is used for each encounter where the patient is receiving active treatment for the condition. So active treatment means for the first time patient is seeing the physician and patient will undergo the treatment. So what is seventh character D? Seventh character D is subsequent encounter is used for encounter after the patient has completed active treatment of the condition and is receiving routine care for the condition during the healing or recovery phase. If you would like to add seventh character D, which will be subsequent encounter, when do we code subsequent encounter? So if the patient has completed active treatment and is receiving routine care for the condition during the healing or recovery phase, we will code subsequent encounter. So we will not use aftercare Z codes for injuries or poisoning, where we have seventh characters are provided to identify subsequent care. For example, if we take for aftercare of an injury, assign the acute injury code with the seventh character D, subsequent encounter. Seventh character S, sequela is for use for complications or condition that arise as a direct result of a condition such as scar after a burn. When using seventh character S, it is necessary to use both the injury code that precipitated the sequela and the code for the sequela itself. The S is added only to the injury code, not to the sequela code. The seventh character S identifies the injury responsible for the sequela. The specific type of sequela is sequenced first, followed by the injury code. So here we have few example scenarios for our guidelines. We will learn those. So here injury of left wrist and dislocation right elbow from fall on escalator in public building. Dislocation was reduced. Here we need to code injury of left wrist and dislocation of right elbow, and these are external cause codes. As all of us know, most of the time in chapter 19 we need to use external cause codes, as here patient is undergoing active treatment for the first time. So here we have added initial encounter A as a seventh character. So we have one more example here. The patient is seen in follow-up for healing blowout fracture. Here we need to add subsequent encounter as 0 to 30 into D, as here patient has completed the active treatment and he is visiting for the follow-up. So here we need to code subsequent character, which is D, as a seventh character value. Here we have one more example for sequela. So here patient has left wrist with keloid scar due to previous burns from the fire, accidental. So based on our guidelines, the specific type of sequela is sequenced first, followed by the injury code. So if you see here, due to the burn, patient has keloid scar. So we need to code condition first, which is L91.0, and next we need to code sequela code like injury code, which is using the seventh character S. Here if we check this one, T23.072 S. So seventh character we have used as S, which is based on our guidelines. Next guideline, coding of injuries. So whenever we code injuries, we need to code separate code for each and every injury. So if we have combination code, we need to code combination code of injury. Usually we will code T07, unspecified multiple injuries should not be assigned in the inpatient setting unless information for a more specific code is not available. So we can't code T07 in inpatient setting. So whenever there is no documentation, we can code T07. So here traumatic injury codes S002 T14.9 are not to be used for normal healing surgical wounds or to identify complications of surgical wounds. The code for the most serious injury as determined by the provider and the focus of treatment is sequenced first. So whenever we have multiple injuries, we need to check the which one is the serious condition and what is the focus of the treatment. So which will be we need to code as a first code or primary code. Next guideline, superficial injuries. Whenever we have more complicated injury with like simple injuries like abrasions or contusions, we will not code abrasions or contusions along with the more severe injury of the same site. For example, we have abrasion with laceration to the right knee. Here we will code only laceration. We will not code abrasion, as laceration is more complex than abrasion. Next guideline, primary injury with damage to nerves and blood vessels. So when a primary injury results in minor damage to peripheral nerves or blood vessels, the primary injury is sequenced first with additional code for injuries to nerves and spinal cord and an injury to blood vessels. When the primary injuries to the blood vessels or nerves, the injury should be sequenced first. We have one more example for this guideline we will check. So minor laceration of splenic artery and fracture of right little finger due to trauma from being kicked and falling during a football game. Suture of laceration of splenic artery. Basically here, because of the primary injury, if the patient has peripheral nerves or blood vessel damage, we need to code primary injury as the first code, and additional code we need to add injuries to nerves and spinal cord under injury to blood vessels as the secondary code. If the primary injury is to blood vessels or nerves, we need to code that injury as the first code or primary code. So we need to check the documentation whether what is the reason for blood vessels or nerves injury. If the because of primary injury If the patient has peripheral nerves or blood vessel damage, we need to code primary injury as the PDX, and secondary code we need to code blood vessels or nerve damage. Whenever if the patient has primary injury is the blood vessels or nerves, we need to code injury code as the sequenced first, or blood vessels or nerves damage or the injury we need to code first. In this example, patient has laceration of splenic artery and fracture of right little finger. So here the focus of the treatment is suture of laceration of splenic artery. So here primary code is splenic artery laceration. So here we have coded S35.291A for splenic artery laceration and X62 series for right finger fracture. Next guideline, heterogenic injuries. Injury codes from Chapter 9 should not be used for injuries that occur during, as a result of, or medical intervention. Assign the appropriate complication code. So, what is the meaning of heterogenic injuries? Heterogenic injuries are the injuries which will be occur due to medical interventions. So, whenever we have complication due to medical intervention, we need to code it as a complication. We can't code them as a Chapter 19 series code. So here we have an example. Accidental puncture and laceration of a digestive system organ or structure during other procedure. So here we have not coded chapter 19 series injury. Here we have coded complication K91.72. Next we will learn coding of traumatic fractures. The principles of multiple coding of injury should be followed in coding fractures also. Like if the patient has multiple fractures, we need to code multiple fractures. If the patient has multiple fractures with combination code, we need to code combination codes for traumatic fractures. So fractures of specified sites are coded individually by site in accordance with the both provisions within the categories S0 to S92 and the level of detail furnished by the medical record content. So we need to check whether patient has single fracture or multiple fracture or same site or different site. If the patient has different site, different fracture, we need to code multiple fractures using the different sites. So a fracture is not indicated as open or closed should be coded to closed. So if the physician does not mention whether fracture is open or closed, we need to consider default as closed fracture. If fracture is not indicated whether displaced or not, we need to consider it as displaced fracture. So we have an example here. The patient has closed fracture of right surgical neck of humerus and left open fracture of anatomic neck of humerus. Here we have coded S42 2 series 2 codes as we have fracture at the different sites in the neck of humerus. If we have specific ICD-10 CM codes for multiple fracture, we can code those multiple fractures. We have one more guideline here, initial versus subsequent encounter for fractures. So for traumatic fracture, as we learned previously, we have three seventh character values which are A, B and C. Here these are based on whether patient is receiving active treatment for the fracture. The appropriate seventh character for initial encounter should also be assigned for a patient who delayed seeking treatment for the fracture or non-union. So for example, patient has fracture in January and this month is December. So if the patient comes for fracture treatment in December, which will consider it as a initial fracture treatment only, or we will consider it as a active treatment for the fracture irrespective of the duration of the injury or fracture. For fractures also, seventh character for subsequent care if the after the patient has completed the active treatment. So if the patient has complication due to the treatment of the fracture, we need to consider it as a complication codes. So if the fracture treatment is not proper, patient may have malunion or non-union should be reported with the appropriate seventh character for the subsequent care with non-union KMN or subsequent care with malunion PQR. So malunion or non-union. The appropriate seventh character for initial encounter should also be assigned for a patient who delayed seeking treatment for the fracture or non-union. The open fracture designations in the assignment of the seventh character for fractures of the forearm, femur and lower leg, including ankle based on the Gestilo open fracture classification. When the Gestilo classification type is not specified for an open fracture, the seventh character for open fracture type 1 or 2 should be assigned BEHMQ. So we have an example here. The patient suffered a blowout fracture 1 week ago and is now being referred to a specialist for consultation. Here we have coded one seventh character A only as initial encounter. Y means patient has fracture 1 week ago, but patient did not seek the medical intervention before coming to this consultation. So we have coded here A as a initial encounter or active treatment. Next example, subsequent encounter for malunion fracture of right tibia from motor vehicle accident. So here patient has subsequent encounter. Here patient has malunion. So here our seventh character differs. We will check in the code book. If you see here unspecified fracture of shaft of right tibia subsequent encounter for closure fracture with malunion. So here patient has complication of malunion. So here because of that reason we need to code seventh character as P. So here we have one more guideline based on this. If the patient has osteoporosis and if the patient encounters a fracture, we need to code a M80 series code, not a traumatic fracture code. So we need to check the documentation if the patient has osteoporosis or not and what is the fracture site. So basically for fracture we will not use aftercare Z codes. We will use seventh character values. So next guideline we have multiple fracture sequencing. Multiple fractures are sequenced in accordance with the severity of the fracture. We have an example here. The patient has a fractured parietal bone of the skull and fracture of the left fifth rib. So here parietal bone fracture is more complex, so we will code it as PDX. We have one more example, fracture of multiple metacarpal bones of the right hand. So here also we need to code S62.309A as the PDX. So for physial fractures, we need to assign only the code identifying the type of the physial fracture. We will not assign a separate code to identify the specific bone that is fractured. And we have a coding of burns and corrosions. Here we need to know the difference between burns and corrosions. The burns codes are for dermal burns except sunburns that come from heat source such as fire or hot appliance. The burn codes are also for burns resulting from electricity and radiation. Corrosions are due to chemical. So other than chemical, we will consider it as everything as a burn. But corrosions are burns due to chemicals. If the patient has burn due to chemical, we will consider it as a corrosion, not burn. So basically burns are classified by depth as first degree erythema, second degree blistering and third degree full thickness involvement. So we need to check the depth of the burn patient has occurred. So burns of the eye and internal organs are classified by site but not by degree. So whenever we have multiple burns, we need to code highest degree burn first, then lowest degree. So if the patient has multiple external burns, we need to sequence the first the code that reflects the burn of the highest degree. If the patient has both internal and external burns, we need to code based on the circumstance of the admission. The patient has burn injuries as well as other related conditions such as smoke inhalation and respiratory failure. We need to check the circumstance of admission and based on the that we will select the principal or first listed diagnosis. So we have an example here. Second degree burns of the left hand and first degree burns of the left forearm. So here we have coded second degree burns of the left hand initially, and first degree burns of the left forearm laterally. So why means as per the guidelines we need to code the first highest degree burns, later lowest degree burn. If the patient has burns of the same anatomic site, we need to code the highest degree burn. We have an example, second and third degree burns of the right thigh. Here we need to code T24311A. So here third degree burn is more complex or severe than the second degree burn. So we need to code only 1 degree here. So non-healing burns. Non-healing burns are coded as acute burns. Necrosis of burned skin should be coded as non-healed burn. So we have an example here. Active treatment for necrosis of third degree burn on the buttock. T21.35 into A. So we have one more example here, infected burn. For any documented infected burn site, use an additional code for the infection. So if you consider one example here, active treatment of infected burn right foot. So here we have coded right foot burn and as well as the infection of right foot. So here assign separate codes for each burn site. So whenever patient has multiple burn sites, we need to code each and every burn site. So codes for burns of multiple sites should only be used assigned when the medical record documentation does not specify the individual sites. So here we have an example. Multiple burns over the entire body. The patient expired before he could be admitted. Here we need to code T30.0 as we don't have any specific sites related to burns. So here we can code multiple burns. So next guideline, burns and corrosions classified according to extent of body surface involved. So usually we will use T31 series for burns classified according to the extent of body surface involved. T32 for corrosion classified according to the extent of body surface involved. So we have one more example here. The patient has second degree and third degree burns of the trunk and first degree burns of the right arm. So we will code T21.30 and T22.10. So if we check T31.10 in the code book, it tells us burns involving 10 to 19% of body surface with 0 to 9 degree third degree burns. So encounters for treatment as sequela of burns. Whenever the patient has sequela of burn, we need to code like scars or joint contractures. We need to code burn or corrosion code with seventh character as S for sequela. Here we have an example. Contracture of the skin of the right index finger due to burn from the injury 6 months ago. So we'll code here L95.5 T23.021S. So whenever we have a scar or joint contracture due to burn, we need to code the condition first, then injury code along with sequela code. Seventh character sequela, which is S. Next, we are going to learn adverse effects, poisoning, underdosing, and toxic effects. So, codes in category T36 to T65 are combination codes that include the substance that was taken as well as the intent. No additional external card code is required for poisoning, toxic effects, adverse effects, and underdosing codes. So, So codes in category T36 to T65 are combination codes that include substance that was taken as well as the intent. So we no need to use external cause codes along with adverse effects, poisoning, underdosing, and toxic effects. So we can't code directly from the table of drugs. Always we need to check the tabular list. Next one, use as many as codes necessary to describe. We need to code as many as codes as necessary to describe completely all drugs, medicinal or biological substances. So the same code would be describe the causative agent. The same code would describe the causative agent for more than one adverse reaction or poisoning or toxic effects or underdosing. We need to code only once. If two or more drugs, medicinal or biological substances are taken, code each individually unless a combination code is listed in the table of drugs and chemicals. Next one, the occurrence of drug toxicity is classified in ICD-10 is as follows. Guys, we need to understand these definitions. Adverse effect, when coding an adverse effect of a drug that has been correctly prescribed and properly administered, we need to code nature of the adverse effect followed by the appropriate code for the adverse effect of the drug. So for example, patient has tachycardia due to any type of drug or adverse effect, we need to code tachycardia first followed by adverse effect code. So what is poisoning? When coding a poisoning or reaction to the improper use of a medication, first assign the appropriate code for categories T36 to T50, then condition code. So we have an example here. While in the hospital, the nurse accidentally gave the patient 40 milligrams of Lasix instead of the ordered 20 milligrams dose. So the patient suffered no ill effects, T50 here. So error was made during prescription. Here error was made in the drug prescription or in the administration of the drug by provider, nurse, patient or other person. So word of drug intentionally taken, which will come under poisoning. So what is underdosing? Underdosing refers to taking less of a medication than is prescribed by a provider or manufacturer's instruction. Discontinuing the use of prescribed medication on the patient's own initiative is also classified as an underdosing. For underdosing, we need to assign the code from categories T36 to T50. So if we check this table, here left first column is drug name, next one is poisoning accidental, second one poisoning intentional, next one poisoning assault, next one poisoning undetermined, next one adverse effect, next one underdosing. So if the patient has poisoning, we need to check whether it is due to accidental, intentional, assault or undetermined. Next one is toxic effects. When a harmful substance is ingested or comes in contact with a person, this is classified as a toxic effect. The toxic effect codes are in categories T51 to T65. So here we have an example. A 2-year-old accidentally drank eye causing burns to the mouth and throat. Here T54 series we have coded for burns. So here basically here toxic effects are due to harmful substances, not due to medicines or medications. So these adult and child abuse, neglect and all other self-explanatory. You can read, we can understand easily. And these are more rare in our coding process. Next important one is complications of care. General guidelines for complications of care. Documentation of complications of care. We will check in other chapter. Pain due to medical devices. So if the patient has acute or chronic pain, we need to code additional code. So here patient presents with acute pain secondary to displaced nail in the right femur. So here we need to code T84 series first. Next, as the patient has acute pain, we need to code G series code and as well as the other codes. Excellent. Transplant complications. Transplant complications other than kidney. So codes under T86 complications of transplanted organs and tissues are for use for both complications and rejections of transplanted organs. So we need to use T86 series for complications of transplanted organs. So a transplant complication code is only assigned if the complication affects the function of the transplanted organ. So if the patient has complication due to transplanted organ or this affects the function of the transplanted organ, we need to consider it as a complication. So in order to report this, we need to have two codes. First one is two codes are required to fully describe the transplant complication. The appropriate code from T86 and a secondary code that identify the complication. So we have an example here. A patient with previous intestinal transplant presents with diarrhea which has been diagnosed as acute graft versus host disease. So here we need to code it as a complication first, then other conditions. Next one, kidney transplant complications. Patients who undergone kidney transplant may still have some form of kidney disease. So because that kidney transplant may not fully restore kidney function. code T86.1 should be assigned for documented complications of kidney transplant, such as transplant failure or rejection or other transplant complications. So if the patient has kidney transplant, even though patient has kidney transplant, that kidney transplant will not completely reduce the kidney disease. So we need to code CKD stage also along with kidney complication. So whenever we have to code T86.1, we need to check the documentation for transplant failure or rejection in the documentation. So if the documentation unclear, we can't code rejection or transplant failure. We need to query the physician. We have an example here. Patient with history of kidney transplant presents to the ER with gastroenteritis. His review of system documents CKD and hypertension. Here, patient has gastroenteritis, so we need to code K52.9 as well as CKD stage and hypertension, and 89 for CKD and I129 for HTN with CKD combination code. We have one more example. Patient with history of kidney transplant present to hospital in acute renal failure due to rejection. Here, physician specifically mentions acute renal failure due to rejection. So we need to take it as rejection and we need to code T86.11 series code. Next one, complication codes that include the external cause. So as with certain other T codes, some of the complications of care codes have the external cause included in the code. The code includes the nature of the complication as well as the type of procedure that caused the complication. No external cause code indicates the type of procedure is necessary for these codes. So for some conditions, the procedure itself is included in the codes. Here we no need to use external cause codes. Next one, complications of care codes within the body system chapters. Intraoperative and post-procedural complication codes are found within the body system chapters with codes specific to the organs and structures of that body system. These codes should be sequenced first, followed by a code for the specific complication if applicable. So we need to code these codes first by specific complication next. Like intraoperative post-procedural complications, we need to code first by the specific type of complication whenever patient has the intraoperative and or post-procedural complication. So basically complication codes from the body system chapter should be assigned for intraoperative and post-procedural complications unless the complication is specifically indexed to a T code in the chapter 19. Thank you guys. I hope this session is very much useful. So please like, comment and share. Thanks for watching Fast Coder 21.